Saving lives reduces costs, improves quality, and expand healthcare to all Filipinos. With these major advantages, generics are no longer seen as merely cheap alternatives, but rather a solution to improve access to medicines. Over the years, the government continuously pursued efforts to ensure universal access to medicines through generics. In 1986, the movement began. A revolution was born with the father of Philippines generics, the former Health Secretary Alfredo Bengzon. He created a task force to develop the first national drug policy, people empowerment for quality, for rational drug use, for self-sufficiency, for tailored procurement. On September 13, 1988, former President Corazon Aquino signed the Generics Act of 1988. It was authored by former Senator Orlando Mercado, a landmark law that embodied the freedom of Filipinos from the high cost of branded medicines, which provided Filipinos with affordable medicines. The National Drug Committee crafted the Philippine Drug Formulary in 1989. The national government pledged to make available essential medicines to address the healthcare needs of Filipinos. The National Drug Committee launched a national campaign on the rational use of medicines in hospitals. During the term of former Senator Flavier, the Philippine National Formulary was officially adopted as the basis for government procurement. The campaign also advocated for tailored procurement of essential medicines in the public sector. The national drug policy continued to face transformation, as well as challenges and opportunities for the government, industry, health providers, and patients. A formidable challenge in implementing the generics law faced by then former Secretary Dr. Carmencita Riodica was the resistance from the multinational companies and the private sector. However, despite the difficulties, Dr. Riodica ensured that the DOH continued to provide informed choices on Filipinos about affordable generic medicines. The advocacy on generics became an important priority of the Department of Health since the law was passed in 1988. During the term of former Secretary Alberto Romualdez, the national government embarked on the Parallel Importation Program as a new response to the continued high prices of innovator medicines in the country. DOH hospitals were directed to establish their own boticas. In 2001, the national government vowed to cut drug prices by half in 10 years, with the Philippines having one of the highest in drug prices globally. Then, former Health Secretary Manuel Dairit continued the generics advocacy and started to build botika ng barangays in hard-to-reach rural areas. In major cities, the botika ng barangay was also created, further increasing competition in the market. The past decade saw the spread of thousands of B&Bs all over the country. The B&B business model was later adopted by the private sector, leading to the establishment of generic drugstore chains in the Philippines. Truly, the government is no longer alone in this fight. Consumers have more affordable choices through quality generic drugs. Despite these significant achievements, the efforts of the Department of Health on generics did not stop there. In 2006, during the administration of Secretary Francisco T. Duque III, halving the prices of medicines became a central agenda of the department. The Universally Accessible, Cheaper, and Quality Medicines Act of 2008 and its twin legislation, the Food and Drug Administration Strengthening Act of 2009, were passed, further strengthening the gains of the Generics Act. The efforts of the DOH to lower down drug prices were met with fierce resistance by the industry. There were powerful lobbies against the pricing reforms of the department. The DOH engaged different sectors, including civil society, in an open and multi-stakeholder dialogue in its efforts to make the pricing of medicines more transparent and fair and protect the more important public health interests of the Filipino people. Further expansion of the Botica ng Barangay to hard-to-reach areas was pursued by the Department of Health. A series of mandatory and voluntary price reduction schemes were implemented in 2009 and 2010. In 2011, the DOH adopted the Philippine Medicines Policy, an expression of the highest commitment of the national government to the goal of universal access to medicines. Because of generics, we have reached millions of patients nationwide through the DOH program Complete Treatment Packs and other medicines access programs. All RHUs were given access to antibiotics and maintenance drugs for hypertension, high cholesterol, and diabetes. Through the DOH Medicines Access Program, more than 4,500 breast cancer patients were reached. At least 4,000 children with leukemia received free chemotherapy. More medicine access programs were launched by the Department of Health. Today, as part of the Duterte administration's thrust to provide quality, affordable, and accessible healthcare services for Filipinos, the Department of Health initiated the revival of the Botica ng Bayan program through the launching of its pilot sites in Isabela, Cebu, and Davao City. This year, as generics law marks its 30th year, together with our partners, we vow to remain steadfast in pursuing our reforms towards our goal of universal access to medicines.